Well, good afternoon, everyone, both to those who have joined us on Zoom and to all of you on Facebook Live. We're very excited because this is our first time broadcasting a webinar on Facebook Live. My name is Meg Olson, and I lead up the grassroots mobilization team here at Network, and I would like to welcome you all to our webinar, Network's COVID-19 Response, Updates, and Our Work Ahead. This afternoon, joining me is, of course, our Executive Director, Sister Simone Campbell, and two members of our Government Relations team, Trelon Shorter and Laura Peralta-Schulte. On this webinar today, we're going to be discussing the current COVID-19 state of play. We're going to be reviewing the 3 congressional packages that have happened so far, and also what our requests for Package 4 are. We're also going to tell you what you can do as our network advocates and activists. We will pause for questions, and I just want to show you how to ask questions. If you're on the webinar, there's a Q&A box, and you can type in your question there. We have 2 people on the webinar, Gio and Anne-Marie from our Government Relations team, who are monitoring the Q&A box. For those of you joining on Facebook Live, our comms team lead, Colleen Ross, is monitoring that, and she is going to be looking at your questions, and there will be time for her to read your questions for all of us as well. If you are having any sort of technical difficulties, please use the chat box for that. All right, and welcome Judy Rice from Hemet, California. I see you chatted us. All right, so from there, we are going to begin. I'm going to hand it over to Sister Simone.
Thanks, Meg. Well, as I was reviewing our slides, I realized, oh my glory, so quickly these are out of date. What we know is that the number of COVID-19 cases in our nation are rising significantly, and the number of deaths are increasing dramatically. As of last night, there were 4,600 deaths due to the virus. Now you can see the map where there are hotspots, but I think what is important to notice is that every state has an outbreak, and that we need to therefore realize that this is all about our whole nation and our whole world engaged in addressing an illness at one time. This is making it challenging. Go to the next slide. Now, here's one of the challenges, the economic state of play. I'm sure you've heard that the president a couple weeks ago was saying, oh yes, we're gonna open up the economy. We need to take care of the economy. Well, the economic reality is that as of today, there are 6.6 million people unemployed that were employed 2 weeks ago. And this is a huge shock to our nation. One of the hardest parts about this is who the people that are suffering this unemployment are. So many of them are in low-wage jobs, or in the gig economy, or are have limited benefits and had absolutely no warning that their job was going to be terminated. So there is a really serious concern about what's going to happen to so many of our struggling families. The next slide. So what do we know? Well, we know that COVID-19 is exceptionally difficult for low-income families and for communities of color. Some of this reason for the adverse impact for people of color and higher mortality rates from COVID is because of the general health inequity in our nation. The fact that We do not have a system that works evenly for all people. And historically, communities of color, even in the same economic level as higher income folks, have worse outcomes. And there are many reasons behind this. We've done a lot of work on health equity in our work at Network. We can talk more about that. But what you need to know is that it's true also in fighting this the coronavirus. There's also a lack of adequate resources in impoverished neighborhoods. We've been working so hard to make sure that our community health centers and the frontline healthcare delivery systems have support that they need, but they are strapped and struggling. Then there's the economic and employment hardships that I talked a little bit about before. And this is that more often, or there's a higher percentage of people of color in the service sector jobs and the fast food industry and lower wage jobs, and then in white collar or capacity to work from home jobs. So this means that our communities of color, as well as our other low wage workers, are having to go out when we're just being advised to hunker down and stay home. The other piece to be named here is that the media and the administration have been blaming this virus on the Asian population, or inferring that it's, as the president said, the Chinese flu or the Wuhan flu. The anguish of that is that it perpetuates a lie that focuses animosity on the Asian community who do not deserve it. So I believe that we people of faith really have to make clear that this is unacceptable, that this is an illness. This is not about a nationality or about a racial difference. This is about something the whole world is suffering, and we need to be right about it. With the heightened racism towards Asian Americans, we really need to speak up and talk to our neighbors and our friends to make sure that they don't inadvertently perpetuate it. And finally, lower income communities and communities of color have less access to quality healthcare facilities. This is because there's higher incidence of uninsurance. There are higher incidences of not having access to a primary care physician, of relying on public clinics. You can get good treatment there, but you don't have ongoing support that you need. I just got an email from a person who I know who is recovering from the virus, and he says that it is a long, slow haul to get over it. He's been sick for over 2 weeks. Now we know that low wage workers or folks who are struggling don't have the cushion to be able to absorb that reality. And that's why we're going to talk about some of the steps that have been taken to make a difference in our nation, because our people are struggling, and that's the bottom line. We're in this together, but some are struggling a lot more than others. I think we can move to the next one, Meg. So let's look at the congressional response. And I want to pass this over to Trelon Shorter, who is one of our major Domo government relations folks. Now, I've got to say this is a point of personal privilege. Our government relations people have been working flat out for weeks to make a difference, to help get these bills passed in a way that really serves the people. So you're going to hear from some of my heroines, champions, who have done an amazing job to help make this happen. So my whole the whole network team has really been at it, but I sort of feel especially proud of the government relations folks. Trelon, do you want to take it?
Sure. I'm delighted to be with everyone today, and thank you, Sister Simone, for that recognition. It is true that our teammates, we have been really working hard over the last couple of weeks to pull together a set of provisions in 3 packages that reflect our Mend the Gap priorities. Like each of you, we're trying our best to manage the emotional impact of this pandemic. And while all at the same time fighting for the common good while keeping the appropriate social distance. And so within days, all of our Mend the Gap issues were suddenly at play, competing with a multitude of special interests in this town. And so, as you know, the toll of this novel virus is far-reaching, yet too soon to determine the true scale of the impact. It's also too soon to know with any certainty whether the virus reached our shores well before the January 2020 date of the first case in Washington State. But based on the available data prior to March 27, Congress formulated 3 policy responses, each designed to rapidly respond to the public health crisis to provide relief for workers, relief to families, and relief to businesses. You see on the slide, there are 3 bills, and so I'd like to go to the next slide to talk to you about what was in the first bill. So the first bill that Congress passed was H.R. 6074. It was, I believe, roughly an 8-page bill, which was signed by the president on March 6th. And it includes $8.3 billion in emergency funding for federal agencies to respond to the coronavirus outbreak. So the bill originated in the House as an emergency supplemental appropriations bill, subject to no spending caps, which was significant. The bill was relatively non-controversial and passed by majority roll call vote in both chambers. As you can see, the bill included, if we go to the next slide, the bill included $2.2 billion in public health funding for prevention, preparedness, and response. It included, within that amount, it included $950 million to support state and local health agencies. Also, it allows $7 billion in low-interest loans to affected small businesses. It included $300 million to ensure access to affordable vaccines, and then more than $3 billion for research and development of vaccines and therapeutics and diagnostics. For the health community, they were to receive $1 billion for medical supplies, for healthcare preparedness and medical research capacity. And then finally, about an estimated $1.25 billion to secure Americans' health by addressing the coronavirus overseas. And so for us at Network, we were pretty pleased with that bill. Again, it flew under the radar, and we, in fact, recognizing we knew it was emergency supplemental, we knew that it was emergency response, infusing lots and lots of dollars to the health community. We watched and allowed it to pass without us having to take any type of grassroots action. So from a government relations, we monitored it. But it was interesting, though, that as the toll of people in our country were being affected by the coronavirus, that our more response was going to be needed beyond the first package. So now let's take a look at the second package. In the second package, that's H.R. 6201, the Families First Coronavirus Response Act. So it started off the same way as the first bill. It originated in the House and passed with bipartisan support. There were ultimately about 40 members of the House that dissented in the vote. Once the bill made its way over to the Senate, it hit snags by GOP senators opposed to the paid leave provisions. And so I want to tell you a little bit about sort of what was in the bill, and then tell you about the politics. So in this bill, it expands testing coverage, mandates paid sick leave, and expands unemployment insurance and expands and adds flexibility to food assistance programs such as SNAP. And so the biggest, like I said, the biggest controversial point in this bill was paid leave provision. So the House passed a very expansive paid leave provision that allowed all employees, no matter how big the company that they work for, that they were provided paid leave protections. So by the time it made its way to the Senate, senators were disgruntled by that particular provision. And in the end, the deal that was reached was to strip out the paid leave provisions for employees that are working at companies with more than 500 employees. So that was the big deal that was reached. And so in the end, for us at Network, we were ultimately satisfied with that. We knew that now was not the time to push harder against the leadership on this particular provision. In fact, we even think that it was the right thing to do, given that employers should be, of that size, should be responsible for covering the cost for their employees instead of requiring the federal government to expense that. So like I said, in the end, Network strongly supported passage of the bill. There were some additional shortfalls outside of the paid leave provisions and gaps in benefits. But ultimately, we believe that that was the right thing to do. So from there, I will turn it over to my colleague Laura, who will talk to us about the third package.
All right, and thank you so much, Trelon and Simone, for getting us to the third package. I too want to talk about both the substance and the politics, because as Trelon said with packages 1 and 2, we had them both originating in the House. By the time we got to package 3, it originated in the Senate. So it was a very different and dramatic turnabout. But again, we were able to work hard to make sure that our Mend the Gap issues were part of the relief package. I just also want to say the idea that you have 3 bipartisan packages in a matter of about a month is really a record for Congress. In conversations with staff, you know, it is clear that our staff is tired. I'm sure you are tired out there in terms of just the virus and just the daily onslaught of discussion about it. And staff up on the Hill is very tired as well. So just want to affirm their good work in the process and walk you through what was in the last bill. So again, we had a situation a bill starting in the Senate. And the beginning of the bill on the substance was really the idea to focus on the business community. Because if you are watching the stock market, again, as Simone said, we have unemployment numbers out today. You see that businesses, large and small, are really struggling in this new normal. So the intent of the third package was really focused on how to bring relief, immediate relief, to the business community. I think what we were able to add in terms of the folks from the human needs community was to affirm the need for business supports, particularly small businesses who are really struggling and have had to close their doors, restaurants and others. But not to forget the serious needs that exist right now from a healthcare perspective, and again on marginal communities that are really just struggling to get by. In the end, it was a much more comprehensive bill than the Senate Republicans had initially put on, and let me tell you about it. So the first thing, and this was really a Democratic request, was while we had healthcare dollars put in initial bills, it was very clear that given the uptick in cases throughout the country, that we needed to upspend to provide more money for the healthcare system. So we were able to, and the Senate was able to secure $100 billion worth of new spending for hospitals, for healthcare providers, and equipment. One of our priorities all year has been to affirm and to get money for community health centers whose money was about to run out in May. And in that package, $1.3 billion worth of emergency funds went directly to community health centers. So just affirming how important those centers are for rural communities, for the immigrant community, for folks who are typically uninsured and needing access to healthcare. Another big win in the second package that was again a Democratic priority was unemployment insurance. And really expanding that to meet the incredible needs that exist right now. So in the bill, we, the Royal Wheel, were able to get assistance to workers who lose their job, 4 months of assistance. And unlike previous unemployment expansion efforts, we were able to get expansions to include gig workers, to include the self-employed, to really expand the pie in terms of who is eligible for unemployment. This system and the direct payment systems are going to roll out in the week or so, going through the implementation process and then ultimately to the states. But we were very pleased that at the end of the day, you had a major, really structural change in the uninsurance area so that a wide swath of workers would be protected. Is there more to do there? Yes. But we were pleased that this was really a structural change in the way that, that families and the unemployed are treated. Finally, in terms of a Democratic priority, and I must say there were some Republican members like Mitt Romney from Utah, like members from Missouri, Mr. Hawley, senators who were really concerned about getting very direct payments to families immediately. As part of this package, we were able to secure direct support payments to families, and it was $12,000 in cash payments per individual. So that's if you are a joint filer, $2,400, plus $500 per child. There is a kicker though. There was a limitation, and this is really something that we will be working on as we look forward to a new bill. We had tried very hard to make sure that everybody, we all, our entire communities, receive those payments. Unfortunately, because of political concerns, we were not entirely successful. What I mean by that is at the end of the day, in negotiations between leaders, the member, particularly Republican members, felt very strongly that the immigrant community should not have access to those supports. So under the provision, parents are required to have Social Security numbers in order to have access to those supports. And folks must file either a 2018 or a 2019 tax return. Now, some good news today, there are a certain set of folks receiving Social Security that it looks like the administration is going to waive that. We will keep you abreast of those changes as they happen. But as a general principle, the idea that folks got at least a good number of people will get immediate cash assistance is a positive. Our mission then is to expand who has access to that so that our most vulnerable members will be able to get those very, very important payments. Going to the next slide, we were able to, and credit goes to Trelon Shorter, who works on our housing assistance. Advocates were able to get some housing assistance dollars, $7 billion in investments to expand affordable housing and homeless assistance programs. As you can imagine, for the homeless community, this is a treacherous time because people cannot shelter in place and maintain the distances that you need to be safe. And you have extraordinary health care and food concerns. So it is a down payment. We want to see more expansion in the future, but a down payment to try to meet the needs of our homeless sisters and brothers. I would just say, as it relates to the business community, where we were really focused is to say that we affirm that business will need support, and most of that support will come in the form of loans. But most importantly, that following up on some of the bailout processes in 2008 and 2009, it was clear that there was a misuse of money by a number of the particularly large corporations who were bailed out in terms of using it for stock buybacks, in terms of using it for CEO salaries. So this time, we wanted to make sure that if companies do get support, that there be oversight and there be restrictions in terms of how they can use that money. So we were able to get in language that said, no, this should not go to prop up, your CEO. This should not be used to buy back your stock to the benefit of your shareholders and your senior management. No, we want to make sure this money goes to maintaining employment. And so the structure was adopted to put that in place. And Congress is just beginning to step up and provide oversight to make sure that companies who are receiving that money are doing their best to use it wisely and that there is oversight. The politics of this lead into where we go in the future. And I just really want to affirm that for the politics was actually very much in the third package impacted specifically by the virus. What do I mean by that? That means that in order to get the votes out of the Senate on the package, the senior leadership, the Republican leadership, needed to have a majority. 60 votes to overcome a filibuster. So that is the reason why Democrats were able to move that package forward with the assistance to people that was and hospitals that was included in. In fact, many of the Republicans, there were a number of members who were not in the chamber because of the virus itself. So giving the Democrats a little bit more leverage to get supports for our people. What's next? You are likely reading in the newspaper that there is already beginning talk about a new package. We were just on a call with Speaker Pelosi's office. This will be a House-driven package at this point. And her staff indicated to us that we are not looking at the same time frame of the first 3 bills, praise God, because there were 3 bills in about a month, which is really very, very difficult for staff and to make sure that you are getting everything that you need in a package. So we're looking at a slightly longer process. We're looking at a process that is likely to have two components to it. When what we're hearing on the Hill is that we will undoubtedly need more relief in the fourth package, relief to particularly deal with the health implications. So there's opportunity there. We don't know, and I'm thinking about Simone's slide at the beginning in terms of the economics of this pandemic. Economists, Goldman Sachs yesterday, for example, put out a report. You know, it is very likely that we will be in recession for a good part of this year and likely into next year. It's also an election year. So the question about how do we get our economy going during and after this pandemic is a real question. So what that means is that there's possibility to be talking about both relief and stimulus. So that is the conversation on the Hill. And I think that this is the conversation we're going to be engaged in for the next few months as a package is being put together. Top line in terms of where we as a staff are in terms of the priorities at this point, it is clear that that there is going to be increased need for health dollars. I know that in conversations with staff on the Hill, you know, they are hearing from a lot of folks in the States that they simply do not have the money to spend on very necessary health needs. So what we will be looking for in that package is an increase in Medicaid funding to states in order to pay for the treatment and expenses. We will need to have more dollars going to community health centers. Again, those are the places where folks who are not insured, it's a lifeline for them and they need proper funding. We will also be looking to ensure that testing and treatment covers everybody. Most importantly, that it covers the undocumented and the incarcerated. We are all at risk when somebody is not receiving the services they need to maintain their health. This is a public safety risk. This is a pandemic. And my God, everybody needs to have access to critical care in this time, and that is going to be a priority for us. Also related to our criminal justice work, we know that prisons right now and immigration centers are having huge outbreaks of COVID. We have been asking for the administration to release folks out of detention. We have been asking for BOP to release prisoners into safer areas. So it is really incumbent as they are releasing to make sure that formerly incarcerated folks have access to Medicare when they are going out of prison. So starting that early is key. On the democracy side, again, I said earlier, we are in the middle of an election year. What does an election look like in a pandemic? My colleague, Sister Quincy, is super focused on the issue of voting. We know that we need some radical change to make sure that people have access this year. So we will be looking for $2 billion in funding for the elections. This is funding to ensure that election security measures are in place. This is funding to ensure that there's a comprehensive vote by mail initiative underway. This is to ensure that people can mail in their voting with prepaid postage. We know vulnerable people that are losing their jobs may not have the funds for stamps and other essential things. So again, voting, making sure our votes count, making sure people have opportunities to vote and that it is fair and safe has got to be a priority for us. Other priorities include an immigration framework. We already talked about in the healthcare framework that we need to make sure that our immigrant sisters, brothers are fully covered from a health perspective. We are also going to be working to expand that COVID cash payment system. There is no reason why vulnerable families who are undocumented are not receiving cash assistance. So we're pushing that as a priority. The other priority, and you'll be hearing more from us over time, is we are hearing from the Supreme Court observers that the court has really moved up their time frame for delivering opinions on cases they've already heard. What does that mean? That means we know there is a DACA case before the Supreme Court. We anticipate next Monday or in 2 weeks, we could get a result from the Supreme Court on DACA that could go the wrong way. So we are going to be coming back to you to ask for your help to make sure that embedded in whatever goes forward on this COVID package is an extension of work permits for people with and TPS, because we know that this is no time to leave the most vulnerable and folks who have done all the right things, signed up for DACA, signed up for TPS, leave them without protection. So that is a key priority for us, and we are going to come back to you looking for some help. We know that food is short. Families who are losing their jobs, who have very limited cash, are going to need food. So again, Sister Quincy's leading our work there, trying to expand SNAP allocations by 15%. It is time to double down and make sure our people are whole and have the food they need to thrive. We are also, I'm going to flip those back, talk about paid leave first. We talked about paid leave to make sure that people can stay home, maintain their families, and take time off if they or their families are sick. We're going to be looking for an expansion in that area. And so from a relief standpoint, those are our priorities. The curiosity really comes to the issue of stimulus. And that is where infrastructure is starting to come into play. So as of late, you have Speaker Pelosi and you have Donald Trump saying they want to stimulate the economy now through an infrastructure spend. Right now, Mr. McCarthy on the House side and a leader, McConnell, are saying no, no, no. But we anticipate if the economy does continue to be flat, particularly in an election year, that there's going to be a want for stimulus. So an infrastructure spend is a strong possibility as we move forward. For us, that is opportunity. We know that housing has been a crisis all around the country. So to the degree that we can jumpstart the economy with an expansion of public housing, we really hope that is a possibility. That needs to be tied, of course, to renters relief and to mortgage forbearance. We've got some states doing the right thing in terms of renters forbearance, but it really needs to be a federal policy. We know that in many situations, loans for houses are being forgiven or temporarily stalled, but there's been no relief for renters. So we need renters to have adequate protections as well. I think one of the more interesting possibilities an infrastructure bills sets up for us is to do some work on broadband. Coming out of our Rural Roundtable activities this year, Sister Simone and all our staff can talk about how they were in places that basically have no internet connectivity, where you're paying a check at a restaurant down in Mississippi because they have no way to process a credit card electronically, where children have no access to the internet and are using 20-year-old books. this is unacceptable in a country like ours. And so the idea that we would move forward to really make sure that our rural sisters and brothers and folks in cities who can't afford access and don't have access, ensure that we move into the 21st century as a community is going to be key. Of course, they're looking at some of the traditional spends in terms of transportation. We know that people in rural communities don't have buses sometimes, don't have a way to access urban centers. So really trying to get Congress to think largely in novel ways about what does infrastructure spending mean and how do we use it to mend the gaps. So with that, I'm going to stop and we are very anxious for your questions and very anxious to hear your needs, frankly.
All right. Well, thank you so much, Sister Simone, Trelon, and Laura for sharing all of that information. I know we do have quite a few questions. And the way we're going to do this is we have Gio on the line from Government Relations. We also have Anne Marie, and they've been tracking your questions on if you've been participating through the webinar. For those of you on Facebook Live, Colleen Ross has been looking at your questions that have been written in the comment box. So what we're first going to do, and panelists, just so you know at this point, I have made it so that everyone can see you at all times, just because I imagine this is going to be more of a dialogue than anything else. So what's going to happen first is Gio's going to read a few of the questions from the Q&A box on the webinar. And we'll kind of, Sister Simone, Laura, and Trelon, whoever feels most equipped to answer the question can do so. Then we're going to pause and let Colleen read some questions from our friends on Facebook Live. And then we'll go back to Anne Marie to finish up with the questions on the webinar. All right.
All right. Thank you. This is Giovanna, Government Relations Associate. The question is, what stance or intervention might we make to address the disparities in healthcare suffered by people of color and those economically disadvantaged?
Whoa. There's two levels to that question. One is the enduring disparate outcomes, health outcomes between the white community and people of color. So those are just in normal times, those are issues that are being addressed. Some of the issues are around how medical personnel are trained, how the awareness of most of the testing of drugs actually are done on white men. And it appears that there's some genetic differences that cause different results for different individuals, for women and for people of color, that they're different cultural, different relationship backgrounds. So that's in the big bucket of improving our healthcare system overall. With regards to the coronavirus itself, I think critical issues are ensuring adequate funding and staffing to ensure that the staff in like the community health centers, in the local hospitals, both have what they need for protective gears, the PPEs, the personal protective, materials, as well as a sensitivity and awareness of the different cultural needs or the responses of different communities of color. And so I think that on that level, it's making sure that there's adequate translations available, making sure that everybody gets care, making sure that when those choices are made about who gets a ventilator, that we continue to work with some of the folks making those ethical decisions, the ethical committees in hospitals, to ensure that the issue of disparate outcomes because people of color, traditional history of having worse outcomes, that not be one of the, or that they preference the needs of people of color, knowing that they need to offset this imbalance. Those are some of the ideas, but we have a long way to go on the overall response. Anybody else?
Sure. And I would just add to that, this is Trelon on the government relations team. And so we have been working very closely with the Congressional Black Caucus leadership, and we'll continue to work with their office and with our coalition partners. But a few things that they have flagged around the need to adequately address the medical and health disparities impacting communities of color. And we're already working on this with our original Mend the Gap work. And so the Congressional Black Caucus is coalescing around increased funding for community health centers because those centers are so critical to the communities in which they are based in, and low-income households, families coming from low-income backgrounds. And so that's going to be critical. And so we're pushing for more funding through community health centers. We're pleased that the second bill expanded community health center funding through November 30th of this year. And so we're pleased with that, but we do need a longer and more permanent fix. The benefit of community health, the other component is around telemedicine, and then making sure that, particularly if you are living in rural communities where you don't have adequate access to transportation. So we're likely to see some of this improvement if they're in the net spending package. Hopefully it will include some of the infrastructure work that Laura pointed out. And I'll give you two other things around healthcare before I turn it back over to my colleagues for questions. The other one is the need to provide tax credits for doctors, nurses, and other allied healthcare professionals. So that is something that the Congressional Black Caucus is working with, will be working on, and adequate funding. I think the final point here is around adequate funding to address, culturally and racially specific therapies and vaccines, so that and addressing the mental health component as well.
Can I, Gio, before you go, could I just add on the telehealth piece? This combines with the broadband issue, because what we found in our rural roundtables, if you don't have access to transportation, you probably don't have access to broadband. And up in Wabasha, Minnesota, we heard about the difficulty of doing home health nursing out on the farm, on farms, because the lack of broadband. New Mexico, we heard it about having this trunk line run down the middle of the street, but nobody to pay to get it quarter mile up to the school. So all over the country, this is an issue. So some of us city folk think telehealth can work really well, really easily. No, we need infrastructure to make that happen. So it's a combination of healthcare as well as infrastructure.
Good point. Can we move on to the next question? That is, how much of the healthcare money is going directly or indirectly to insurance companies?
The shorter answer is, I'm sure too much. But Laura, do you want to talk about how some of this is structured?
In terms of the percentage, I guess we may have to post something on our website to answer this question. I do know that the vast majority of our specific work has been on Medicaid and trying to make sure that those programs are fully funded along with the community health centers. So I guess I don't have the detail on that, but we can definitely follow up.
Right. Most of the public dollars actually at this point are going to the hospitals themselves, as well as to ensure research and funding of the both the test and the vaccine. So it's more a direct service as opposed to a payment for insurances. Where there is pressure on the insurance companies, though, is to provide the regulation or the legislation to provide testing and treatment with no out-of-pocket costs to the patient. So that is an important piece that's putting pressure on the insurance companies to step up. As people were pointing out during the advocacy, well, then they'll just, raise insurance premiums later. But at this point, that is most of the federal dollars are going to direct service at this point.
And I will add, once again, this is Trelawn, I will add that is such an important question about sort of accountability. And so what's happening now in Washington is, particularly led by the speaker, is an effort to ensure that there are safeguards so that, that there isn't instances of waste, fraud, and abuse. And so the Speaker Pelosi is working to establish oversight committees. She has authority. There's a 5-panel set of Congressional Oversight Committee that's in the works. She's also working toward establishing a actual panel in the House. And so those kinds of concerns are being raised, and we will be sure to update you as we find out what that looks like in terms of the next steps of forming accountability committees.
I just want to insert myself here for a moment. We have a lot of questions, panelists, and not a lot of time. Yes, I know our question readers are a little stressed here, so thanks.
Shall we get one from Facebook now to give equal opportunity? I can't hear Anne Marie.
Hey, this is Anne Marie. I have another question, not from Facebook Live, but a question from an anonymous attendee is, what about money going directly to private companies, and what oversight is there given Trump's declaration after the passage of the third package that oversight will not be enforced?
I can take that if folks want.
Go for it.
So it is clear that the administration has a process in place, having put staff to oversee the spending of dollars. But as the questioner, I think, is alluding to, almost the very same day that they set up an internal process, they said that some pieces of the bill would not be enforced. So I think Trelawn just mentioned that there is a bipartisan process on Capitol Hill that was set up. I really do think that that was set up specifically to make sure there's a check. It's a separation of powers issue, and Congress wants to make sure that the administration is implementing the bill the way that the law says it is. So there will be oversight on the spending of companies. Very interestingly, there have already been letters from key members of the Senate, a minority leader, Schumer and Mr. Wyden sent a letter to the White House today following reports of shenanigans related to the corporate community. I think all eyes are going to be in this process on whether or not companies are abiding by the rules in the agreement, particularly those rules that were adopted in the third CARES package. And frankly, as we, the community, we, the royal we, are watching these programs roll out, you know, we definitely are also trying to pay attention to news, to feed into our congressional partners to make sure that there is accountability in this process.
All right. Colleen does have a question from Facebook Live.
Hello, we have a question from Melissa Regan, and she asked, could you say again the timing for COVID package number 4, and when will our voices be needed the most?
I think that what Laura was talking about is that we're going to have about a month to at least 6 weeks to help shape this package. We at Network are going to be working with committees of jurisdiction to make sure that our issues get in. And as it begins to shape up, you can do it. And then if you hold your breath for the end, we have an ask for you all to contact your Senate offices, but I'll save the thunder for that one. So contacting now, shaping the package, I would think mid-May, maybe with luck. It's going to be really hard to know. It depends on how this virus shakes out. And as Laura said, it may be at when we're beginning to open up again that it may be most needed. So look for it over the next couple of months for sure. But it's going to be a work in progress that we got to weigh in on. Thanks, Melissa. Next.
Great. The next question from Zoom is from Ann Hill, and she notes that restricting cash assistance to immigrant families with one undocumented parent, even if the other has legal status and even if they've been paying taxes or have a social security number, seems very punishing to entire families, most with some US citizen children. Completely agree, Ann. What is the likelihood that this will change, and what will be the focus on the next package regarding getting at least some immigrants cash assistance?
So it is definitely a priority for us, Anne Marie, as you know, to get to work our hardest to make sure that our immigrant sisters and brothers, some of the most vulnerable people in our country, are getting the same kinds of benefits that that citizens are getting. I will say that there is very strong resistance to this from our Republican friends. We had tried again in this this process to ensure that they would have access to those, and really we were hoping at minimum that they would follow the criteria that they put forward for things like the child tax credit, where they did not give benefit of the credit to parents, but they did in fact allow some of the benefit of the credit to go to US citizen kids. So, so we are meeting, again, that bill where that process, or where the, was the third bill where we got those cash assistance pieces in, that was started on the Senate side. So as we said earlier, we are starting on the House side. It is my belief that Speaker Pelosi as well is deeply concerned about this issue as a San Franciscan with a lot of undocumented folks in her district. So the goal is to get it embedded into the fourth package and then work as hard as we can as it moves through the process.
Additionally, just let me say that some of the political advice, as I know politically, people have been apprehensive about riling Stephen Miller in the White House, who is so anti-immigrant. So we've been working, a lot of the work has been quieter work, but a strategy was encouraging states to use some of the state funding to help meet the needs of the immigrant community in your states. I know states like California has a California, and I'm proud of this, have a much more humane approach to immigration and see our society as one. So there's access to healthcare and access to some funding. So a state strategy is also a possibility, but no, we're working really hard to make it happen in 4.0. Next one.
So we are close on time, but we have been saving all of the questions in the chat box. Would we like to continue? Or we can always get back to all of the very pressing questions that people have shared in the question and answer box.
Could we have one last question so people are prepared that it's the last?
Sure, I actually have a great question that could move us on to our next part of the webinar. Since most of us are sheltering in place, are we going to be mostly reliant on those of us who are grassroots supporters to call our representatives on the Hill? What else might we do to encourage legislators who are not in our home districts to support what we know is right?
Well, Anne-Marie, you're absolutely right. That leads perfectly into our time now to talk about what you can do as advocates. But before I get into these details, I just want to assure you, those of you whose questions were unanswered, we do have all of your email addresses, and as Gio said, they are noting those questions and we'll make sure they get response. Also, I know some people are wondering, yes, we are recording this. You will receive the recording and you will also receive a PDF of the slides. So after this webinar, those things will also be available on our website to our friends on Facebook Live. So how do we influence Congress when we're all sheltering in place? That is a great question. First of all, instead of being on the Hill, our members are actually home. Both of the House and Senate are out and policy work is happening. As we know, Congress is exploring more and more ways to do virtual work and possibly even virtual voting. So I cannot tell you enough that home contact, your in-district offices contact, is key. And this is going to require a little bit of innovation because you can't just walk down, get in your car and drive over to your in-district office. Luckily, we have already had, I just have to give a shout out to our network grassroots advocate team in Cleveland, Ohio. They already tested this for us. They had a phone in-district meeting with Senator Portman's office, and it was a great visit. So we know that in-district offices are setting up in-district meetings over the phone. Of course, if you have access to something like Zoom, that could work as well, but phones are great. So this is our virtual lobbying. So the way we're going to do this, first of all, just want to let you know, we are going to be continually updating our COVID-19 blog that's on our website. Colleen and our comms team and our GR folks and everyone who's been writing for us has been doing a great job. And I also just want to give a shout out to some of our network members who have also been writing blogs and sharing those ideas. So keep the stories coming. Let's keep the momentum going. So now back to those in-district phone meetings. As you heard, we're going to have at least 6 weeks to work on this. And we are moving into Holy Week and Easter and Passover as well. And so we're all going to take a little bit of a break, starting next week. But what you can do right now is, if you are interested in signing up for an in-district phone meeting with one or both of your senators, we've created a link. And networklobby.org/meeting signups. Very clear. For those of you who delivered our February recess certificates, our 100% certificates and voting records during February, this is a very similar process. What you'll do is you'll just fill out your information and let us know which senator or senators you're going to visit. And then based on where you live, our grassroots mobilization team will follow up with you. And after Easter, we're all working together here to get you talking points and leave behinds that, of course, you will email ahead of your meeting. So I think some of you did have some questions about leave behinds. Yes, we will be creating all of those materials that would be just the same if you were going in person. And additionally, members of the grassroots mobilization team will be happy to set up a time for you. And if you're going to have a few people calling in together, you know, over conference call or however you're going to do your call, we will find a time to prep you. There are some, you know, some very key senators that we're going to flag as well to make sure, you know, for instance, like Senator Roberts, key on SNAP. So we're going to have a very special meeting with those folks if you're seeing one of our senators who are on a committee that we really need to target, non-violently, of course. So please sign up for those in-district phone meetings on our website, and we'll get back to you, you know, this week even, certainly next week through Thursday. And then after Easter, we'll send you all the materials and find a time to brief. So we hope that you do this. And also just make sure you're receiving our action alerts. I think you all are if you got an email about this webinar, but I'm sure there will be further activity down the line as we get closer and closer to the vote. But for now, it's time to do that in-district work and really talk to our senators about all of these priorities that were discussed on this webinar. And just before we go, at the beginning of this webinar, of course, Sister Simone and Trelon, and I think all of our panel, and Laura, we all talked about the impact that COVID-19 is happening on immigrant communities and communities of color. We do have a lot of racial justice resources available. And again, this list will be on our website and emailed out to you after this webinar. So be sure to take a look at these, especially some of us last night were on a Color of Change webinar, the Black response to COVID-19, and the stories that they were sharing about the incarcerated population. Just both horrific, but also very hopeful in the opportunity, in the work that Color of Change and some of their colleagues have been doing for those who are incarcerated. All right, well, with that, thanks for hanging in there. I know we went a little over, but we wanted to make sure we addressed as much as possible during this time. So thank you so much for joining us. Thanks for tuning in on Facebook Live as well. And stay safe, stay healthy, stay hopeful, and keep in touch. Just, you know, feel free to email me. You know how to reach us at info@. I'm sure some of you have all of our email addresses, so just keep those emails coming and stay connected. Thank you so much for joining us.